Tina's fine, yeah.
Okay.
Yes.
Tina Almanya'da çalışıyor. Nöro-Atletik Antrenman üzerine çalışıyorlar daha çok. Ben bir eğitimde kendisiyle tanıştım. Şimdi de bizimle birlikte bugün bir tanıtım webinarı yapacak. Bakacağız. Ondan sonraki süreçte nöral sistemin, özellikle ses ve görsel sistemin, visual sistemin insan kas iskelet sistemine etkisiyle ilgili konuşacağız. İlerleyen süreçlerde de kendisiyle bir program serisi yapabiliriz. Now you can share your screen.
Okay. So, well, first I'd like to say thank you for having me, and I'm excited to show you
Okay.
perhaps something new. Okay.
Because this is a new thing for us, actually. So we are looking for what you are going to share with us.
Okay. So just tell me if I should, how much I can speak, and then you can translate, or just tell me to stop.
Yeah, just, okay.
Okay.
We'll see during the presentation.
Sure. Okay.
Okay.
Okay. So neuroathletic, I would describe as the methodology of integrating applied neurology for athletic and strength and functional training. So,
Okay.
yes.
Bugün aslında nörolojinin fonksiyonel, kuvvet ve atletik antrenmanlara entegrasyonunu konuşacağız.
So all of the exercises or the principles, they are based on neuroanatomy, and many of the concepts you can already find in functional neurology clinics.
Bunlar aslında birçok şey fonksiyonel nöroloji kliniklerinde uygulanan şeyler, prensipler.
So before we start, I would like to introduce a thought or a question, because as a functional trainer myself, I asked myself a long time ago, what is the meaning of functional training? What makes it functional? What is functionality?
Aslında ben de bir fonksiyonel antrenmanla ilgilenen birisi olarak yıllar önce kendime şunu sordum. Fonksiyonel antrenman tam olarak neyi ifade ediyor? Anlamı nedir diye sordum.
And so the question that I asked myself is that, could you, with confidence, say that you have the capabilities to learn any sport and become relatively competitive with the body you have right now?
Aslında şu, herhangi bir sporu öğrenmeye güvenin, yeteneğin var mı? Ve onu ilişkili olarak yarışmacı seviyede bedenin ona adapte olabiliyor mu?
Could you, for example, learn how to play basketball with the body that you have right now?
Şimdi basketbol oynamayı öğrenebiliyor musun?
Could you learn how to do acro yoga?
Yoga yapabiliyor musun?
Play lacrosse? Baseball?
Beyzbol oynayabiliyor musun?
Or could you learn how to be a hip hop dancer?
Ya da hip hop dansı yapabiliyor musun?
So I believe that if you are able to say yes to this question, this is the optimal expression of a functional body.
Eğer bunlara cevabın yesse aslında bu bedenin optimal düzeyde kendisini ifade etmesinin bir anlamı.
Because many people, including trainers, they think, for example, oh, I don't have enough coordination for this, I lack the flexibility for this, or the strength for this, and I wouldn't be able to learn something like acro yoga or to play basketball.
Birçok insan şöyle der, bunun için yeterince fleksibilitem yok, yeterince koordinasyonum yok, dolayısıyla bundan işte basketbol oynayamıyorum ya da yoga yapamıyorum.
And for me, these are all deficits in functionality.
Aslında bunların hepsi fonksiyonellikte bir eksiklik.
And having an optimally functioning body means that you are able to do with it what you want.
Aslında fonksiyonellik bunlara optimal düzeyde ne istediğini bilerek, yani ne istediğini bilerek optimal düzeyde bunları yapabilmek.
So what have I told you? That everything that we are, think, feel, and how we move is actually all a result of brain function.
Aslında düşündüğümüz, hissettiğimiz ve nasıl hareket ettiğimiz bunların hepsi beyin fonksiyonlarının sonucu gerçekleşen şeyler.
So I just take you through a journey, my journey, and from the very start to the reasons why I moved towards neuroathletic, and perhaps you will see why the topic is so attractive now.
Bunlar aslında hepsi benim yolculuğumun neden nöroatletik antrenmana doğru kaydığının altında yatan nedenler.
So let's go to the very start. This is me on the left and on the right side.
Soldaki ve sağdaki benim.
So I played and still play competitive volleyball. However, when I reached the age of 18 in Canada, and I'm from Canada, in Canada and in America, there's very limited options for you once you are 19.
18 yani hala oynuyorum. Oynadığımda yarışmacı seviyede de oynadım. 18 Kanadalıyım aslında de. 19 yaşına kadar oynadım ama ondan sonra oynamak zor oldu yarışmacı düzeyde. Are you still playing in competitive level right now?
Yes.
Yeah.
Not professional,
German,
but
right?
yes.
Okay. Almanya'da profesyonel olarak değil ama yine yarışmacı bir seviyede voleybol oynuyor.
So back then I had to search for a new sport, and so I found CrossFit.
Sonra yeni şeyler araştırdım. CrossFit'i buldum.
And so it turned out that I had a natural talent for CrossFit and especially weightlifting.
Aslında doğal bir yeteneğim var bu CrossFit'e karşı, özellikle ağırlık kaldırmaya.
And CrossFit ended up taking me to Europe. I did national and international competitions, and I also trained and competed in France for weightlifting.
Bu beni ağırlık sporlarına yönlendirdi ve uluslararası seviyede yarışma olarak bunu yapmaya başladım.
And so my travels ended up taking me through Europe, and I ended up in Germany. And in Germany and here in Cologne, I opened up a CrossFit gym with a few partners.
Birkaç ortakla birlikte Köln'de bir CrossFit salonu açtık.
So through the years that I trained people with the CrossFit methodology, I found out a few things. And you have to understand, a very strict and militant coach.
What kind of coach?
Very strict. So very careful,
Okay.
very strict. Yeah.
Ve burada CrossFit'te çalışırken şunu fark ettim. Çok katı ve disiplinli hocaları fark ettim.
Yes, and I was very careful about taking people through step-by-step progressions for exercises, and I was very careful to make sure that they did a lot of mobility and flexibility work.
Ve bu süreç içerisinde CrossFit'te yani yavaş yavaş ilerlemeye, adım adım ilerlemeye, yeterince fleksibilite ve mobilite kazanmalarına önem gösterdim.
And even though I was a very strict and disciplined coach, and I tried to make sure that everybody was very safe, I found out that people continually got injured, and I didn't understand why.
Ve insanların güvenli bir şekilde bunu yapmaya özen gösterdim. Çünkü insanların yaralanmasını, neden yaralandığını anlayamıyorum.
So I ended up meeting This man, his name is Lars Lienhard, who created the name Nöro-Atletik Training.
What is his name?
Lars Lienhard.
Mark Lienhard. Bu adamla tanıştım. Bu da Nöro-Atletik Antrenman'ın kurucularından birisi.
And when I met him, I was still doing weightlifting and CrossFit competitions.
Bununla tanıştığımda hala CrossFit antrenmanları ve ağırlık sporuyla uğraşıyordum.
He trains only professional athletes and Olympians.
Sadece profesyonel sporcularla ve olimpik sporcularla çalışıyor.
And he, however, worked with me and trained me as an athlete for 1 year.
Ve benimle de 1 yıl boyunca çalıştı.
And when I was working with him as an athlete, he taught me a lot of things that turned everything that I knew about training upside down.
Ve benim 1 yıl boyunca sporcu olarak çalışırken antrenman hakkında bildiğim her şeyi ters düz etti bende.
So I realized that
Sesi kısabilir miyiz açık olanlar? Yeah, we can go.
Can I go? Okay.
Yeah,
so,
sure.
Sorry. And then I decided that I needed to get the education that Lars had. And the education that I got was from this man. His name is Eric Cobb. And the education that we both did is called Z Health Performance Solutions.
What kind of education you got? I can't hear you clearly.
It's called Z Health Performance Solutions. So everything that is behind Nöro-Atletik, everything that is behind what I do is this educational system.
Okay. Ve Eric Cobb'dan eğitim aldık bu adamdan. Aslında bu Nöro-Atletik antrenmanın arkasında ne varsa yaptığımız şeyin bu adamdan öğrendik.
So I went to a small course. It was just a 3-day course. The whole education is very long. And in this course, I learned about the brain. And when I realized that this brainstem, so this one in orange is your brainstem, that
bu eğitim aslında çok uzun ama hani şey olarak bizim aldığımız eğitimde bu beyin sapı ile ilgili evet.
So on one of the days I learned that your brainstem reflexively sets posture, muscle tone, and inhibits pain.
Beyin sapı aslında refleks olarak hem postürünüzü kurguluyor, hem kas tonunuzu kurguluyor, hem de ağrıyı baskılıyor. Bu turuncuyla görünen yer.
And the important word is that it reflexively does this, which means it's not voluntary, which means that the posture, your muscle tone, and whether or not you experience pain is automatically controlled by your brain.
Aslında bu gönüllü olarak değil, yani refleks olarak hepsi bunların bu beyin sapında gerçekleşiyor. Hem postürünüz, hem kas tonunuzun, hem de ağrının olup olmaması.
So this is why some things that were unsuccessful as me as a coach, for example, when I tried to train people and do exercises to improve their posture, for example, why it didn't work with some people.
Bazı insanlarda çalışsanız bile işte postürle ilgili bir değişime göremiyorsunuz. Aslında bunun altında yatan neden de bu.
So at that point, I realized that either I had to learn all of this neurology or I was going to go on the way that I had been training people before. And so I felt like I had met Morpheus from the Matrix.
Ve şunu fark ettim, bu yolun arkasından gitmem gerektiğini, bu Matrix sistemi gibi.
And so, of course, I went down the other route and I completed the entire education, which takes over 500 hours. And I had to fly to different countries to do this. I then brought it back to my gym and created a new kind of training called Craftletics. And in that time, I've trained over 1,500 different peoples. I've coached over 2,600 hours. I'm in the Master Trainer program. I assist Z Health at some courses, and I also assist Lars on his courses.
Ve bunu aldıktan yaklaşık 500 saatlik bir eğitimi tamamladım. Birçok yere gittim. 1500'den fazla insana bu alanda eğitim, antrenman yaptırdık. 2600 saatin üzerinde bu şey sürdü. Ve aynı zamanda bu sistemin eğitimcisiyim. You are the educator of this system, right now?
An assistant educator.
Assistant educator. Okay.
Yeah. Okay. So I do many group training classes. So that's the main offering that my gym has, group classes. Craftletics is what we do. But I also work with people privately, and these can be from very sick people to professional athletes. And what's the common thing among all the people that I train is that they've already done a lot of physical therapy, chiropractic therapy, ergotherapy. They've done every therapy, and they still have problems. So these are the people who find me to see if they can do anything about these problems.
Aslında bize gelen insanların birçok işte tedavi tamamlamış olarak fizik tedavi, işte kariopraktik tedavi, ergonomik tedavi, işte enjeksiyonlar, akupunktur ve bir sonuç bulamayıp bize gelenler.
So after all of this, I rebranded the gym. We completely do neurocentric functional training, and yeah, got rid of CrossFit, and now it's the only neurocentric functional training gym in Germany.
Ve bunun üzerine biz de nöral merkezli nörosentrik merkezli bir salon açtık. Almanya'daki tek salon.
So, I mean, everything did not change from one day to the next day, and there are a few very important moments along the way that really encouraged me to go in the direction of Nöro-Atletik.
Tabii bu bir günde olmadı. Bir süreç, zaman aldı benim bu yola gitmem.
Yes.
When did it start? How many years ago?
So I met Lars in 2014.
2014, okay.
Yeah.
5 years ago, almost. 6 years.
Yeah, 6-7 years now, almost.
Yeah.
Yeah. So, no, 6 years. 6 years. We're still 2020. Yeah. So there's a few important moments along the way, and first I call them WTF moments, what the F moments, because these moments were really confusing for me, and they really made me question what I was doing.
Which moments?
They're called, in English you say, what the heck moments. WTF moments.
WFT zamanları birçok şey bende sorgulattı. Hangi yöne gideceğimle alakalı. Birazdan sanırım daha da açılacak bu konu. Okay. Ne olduğunu öğreneceğiz.
So we have WTF moment number 1, and I call it the outliers. So there are a few athletes, their situations or their cases were very confusing, and so I will share one of these cases with you.
Birkaç tane sporcu ki bunların durumları çok karışıktı. Ben şimdi onlardan birisinden bahsedeceğim.
So this is Niels. As you can see, Niels is a very fit-looking young athlete.
Gördüğünüz gibi bu genç bir sporcu aslında.
So Niels was 25 years old when he met me, and he was a multi-sport athlete.
birçok sporla uğraşan atlet.
So he played volleyball, he did weightlifting, and not only did he do all these sports, he was very good at all of the sports.
What kind of sports he is doing?
Volleyball, weightlifting, badminton, water skiing.
Bunların hepsini aslında size voleybol, ağırlık, badminton, su kaya.
And he was very, very good at all of the sports.
Ve bunların hepsinde çok iyi.
So he sleeps very well. He has a sleep tracker. His nutrition is good. He logged all of his nutrition for me. He does not drink, he doesn't smoke, and he doesn't take any drugs.
Hiç, yani gayet beslenmesi de çok güzel. Herhangi bir kötü alışkanlığı da yok.
So he has a very, very interesting problem, and that is that he has very high blood pressure. So for a normal person, your blood pressure can be 130 to 140 over 80 to 90.
Normalde 12'ye 8 olması gereken, kan basıncı da ortalamanın üzerinde.
So Niels, remember he's 25 when I met him, his regular resting blood pressure was 150 over 100, and when he trained, it was 180 over 110.
Ve normalde istirahat halindeki kan basıncı bu arkadaşın 150'ye 100 ve antrenmanlarda yaklaşık 180'e 110'a kadar çıkıyor.
And he was taking antihypertensive medication equivalent to what is normally given to a 90-year-old man.
Normalde antihipertansif tedavisi 90 yaşındaki insanlara verilen tedaviyle eşdeğer, bu insana verilen.
He experienced prolonged stalls in strength, so it was very difficult for him to develop strength, even though he trained 5 to 6 days a week and rested properly.
Yani uygun antrenman metotlarıyla yapmasına rağmen yeterince kuvvet gelişimi sağlayamıyor.
So he is one of the athletes which I did not understand. How can a 25-year-old young athlete who is taking care of everything that you can take care of still have something like this blood pressure?
Yani nasıl olur da aklım almıyordu. Genç bir sporcu, yapması gereken bir insan her şey yapmasına rağmen kan basıncı yüksek seyrediyor.
And I can say that I've showed this case at many different events, and always one person in the audience, usually male, they come up to me and tell me they have the same problem.
Ve genelde benim verdiğim şeylerde ve işte canlı kurslarda da mutlaka birisi böyle bir şeyle karşılaştığını dile getiriyor.
So we worked about 1 year together on this problem, and without getting too much into it, we had to do a lot of desensitization work. And so he had to wear things like an earplug, colored glasses, eye patches, to fix the problem. And he sent me this last winter.
What did you do in 1 year?
We had to do a lot of desensitization work. It's
what do you say?
Desensitization. So reducing all the stimulus that he's getting, like light stimulus, sound stimulus.
Okay. Görsel ve işitsel uyarı alanlarla desensitizasyon çalışmışlar 1 yıl boyunca.
Mm-hmm. So last year he sent me this. This is a picture of his blood pressure after a session of training, and it's been stable ever since.
Ve bu antrenmandan sonraki bana gönderdiği şey kan basıncı değerleri.
So WTF moment number 2, I call it a failure in functional transfer.
İkinci şeyimiz fonksiyonel transferde başarısızlık.
So these are members from my gym. There was about 20 people, and we went on a water skiing trip. So this was taken at the time when it was still a CrossFit gym.
Can't hear clearly. What did you say? What is this guy?
These people went to my gym. They were athletes at my gym. There's about 20 of them. And we were doing CrossFits at the time.
Bunlarla CrossFit yapıyoruz. Bunlar benim gym'de spor yapıyorlar. Evet.
And we were there for about 2 hours.
Okay.
And this was how it went. So, I mean, when you first learn how to water ski, it's totally normal that you fall over. Except
İlk kez öğreniyorsanız düşmeniz çok normal su kayağına.
Except that there was 20 people and we were there for 2 hours and only 3 people were able to do 1 lap.
2 saatlik first did you take 2 hours to learn the water ski first?
Sorry?
First did you spend 2 hours to learn the water ski with 20
yes,
people?
20 people, they were given some instructions and then they tried for 2 hours to do 1 loop around the lake.
Bu 20 kişiye önce water ski ile ilgili bilgiler verilmiş. 2 saat denemişler. Sonra 3 kişi bu hani döngüyü tamamlayabilmiş. Düşmeden su kayağını tamamlayabilmiş. Just two of them complete the loop, right?
2 or 3. That was it.
Okay.
And if you think about it, this is not on a boat. So when you do real water skiing, a boat is pulling you. But in this one, it's a cable and it's 1 loop and it's constantly only 1 speed pulling you around.
Kablo ile aslında botla birlikte değil, bir kablo ile belli bir güzergahta sabit hızla.
So if you think about the athletic requirements to do this, it's not that complicated.
Aslında bunun için gerekli olan atletik özellikler çok komplike değil bunu tamamlamak için.
You only have to sit in a small squat. You have to keep your arms straight and you don't move. That's it.
Sadece küçük bir squat'ta eller düz bir şekilde tutuyorsunuz ve hiç hareket etmiyorsunuz. Böyle durmanız gerekiyor.
So the athletic requirement is actually very low. And I thought to myself, how is it possible that these people have been training with me for most of them over a year, that they were stronger, they could lift more weights, they had more coordination, but they could not do this task.
Bir yıldır benimle çalışan, yani bu güçlü, yeterince güçlü sporcular, koordinasyonu iyi olan sporcular, hani bu düşük threshold'daki fiziksel ihtiyaç gerektiren şeyi tamamlayamıyorlar diye kendime sordum.
So I felt like a failure because I own a functional training gym. I'm supposed to train people so that their bodies are more functional, but yet this functionality, it did not transfer.
Yani benim salonum var ve çalıştığım insanlar fonksiyonel antrenman yapıyorlar. Fonksiyonellikleri var. Ama bunu transfer edemiyoruz şu an. Edemedik. This is before Nöro-Atletik, right?
Exactly. Yes, this was just as I started Nöro-Atletik.
Bu ben Nöro-Atletik'e başladığım zamanki durumdu. So why they cannot transfer?
So when you're doing this exercise, there's a very big aspect of the vestibular function. So now when I think about it, it's because they did not do enough balance work.
Oh, okay. Aslında buradaki şey ciddi bir this water ski requires really vestibular function, right?
Sorry?
The water ski
Yes.
requires really demanding for vestibular function.
Yes, because if you think about because if you think
you are doing in your gym.
I was not doing it then.
Yeah, okay.
Yeah. Because if you think about the muscular requirements and the just the position that you have to hold, it's not that difficult. All of them could squat their body weight, you know, so this was not the point.
Aslında bu yani kas fonksiyonları açısından düşündüğünüzde bunların hepsi bunu yapabilecek düzeyde. Bu benim nöroatletiğe ilk başladığım dönemde. Ama buradaki olayda ciddi vestibüler fonksiyonlara ihtiyaç var. O denge için. Ki bunu biz salonda yapmıyorduk.
So all of these WTF moments, they were all just as I was learning about neuroathletic, and they really pushed me towards the direction of going 100%.
Okay.
Yeah.
Bu yaşadığım olaylar o dönemde beni nöroatletiğe daha fazla itti.
So the last WTF moment is the Imperfect Program.
Diğeri de mükemmel olmayan programlar.
So of course, as a weightlifter, I did a lot of strength training programs, and all of the people at my gym, they also did many different strength training programs.
Benim salonda çalışanlar da birçok farklı kuvvet antrenmanı yapıyorlar.
So you have linear and autoregulatory training programs, and I did both of them. So linear is when the increase in weight is linear. So you do, let's say 100 kilos this week, then you do 102 kilos and 104 kilos the next week, and the progression is very linear.
Lineer program basit olarak her hafta işte düzenli olarak kilogram artışı yaptığınız antrenmanda.
And autoregulatory programs are when you're given a specific sets. For example, do a set of 3 reps, and you have to work at 80% perceived exertion, or what you think is 80% of your intensity for the day.
What is autoregulatory?
Autoregulatory is when the program gives you a number of reps and a number of sets, and then the given intensity. So let's say the program wants you to work at 70% intensity. The athlete decides what 70% feels like for them this day.
Okay. Autoregulatory program ya da işte burada set ve tekrar sayıları belli ve yoğunluk da belli. Onu hissederek işte %70 yoğunluğu sporcunun hissederek yaptığı programlar. Okay.
So I did both these kinds of strength training programs, but I also did a hybrid where these 2 training programs are mixed together. And this was created by a very famous Russian Olympic weightlifting coach.
Ve hibrit olarak da bu ikisini karıştırarak da programlar yaptık. Rus ağırlık antrenman bilimcisi tarafından geliştirilen.
So what I learned is that I had maybe 150 members, and everybody was doing these strength training programs. What I learned at the end is that not everybody got better at the end of these programs.
Yani 150 tane üyemiz varsa hiç yani aynı programları uyguladığımızda hepsinde aynı gelişme olmuyordu.
And some people did even worse on testing week.
Ve bazıları test ettiğimizde daha da kötüye gitmiş oluyordu.
And so you could say, okay, maybe they had a bad day, maybe they didn't sleep well, or whatever it is.
Yani hani olabilir, o gün iyi uyumuyormuş olabilir, iyi dinlenmemiş olabilir, yorgun olabilir vesaire.
However, all of the people going to my gym, they are amateur athletes. So they're not professional weightlifters.
Bunlar hepsi benim salonuma gelen amatör sporcular, profesyonel sporcular değildi.
And normally, with amateur athletes, you see a very big growth or a very big improvement.
Normalde bunlarda daha fazla gelişme görmeniz gerekir.
So I was really confused, and I did it again and again and again, different strength training programs, and always some people did not get better.
Ve yani o çeşitli sürekli tekrar etmenize rağmen bazı insanların hiç gelişmediğini fark ettim.
So the same thing is true for mobility programs.
Aynısı mobilite programları için de geçerli.
There are people who I trained for years who wanted to be as flexible as me, and of course, I'm sure you know, and I also know people who are doing mobility work for 20 to 40 minutes every day, and yet they still have the same problems.
Yani günde 20-30 dakika bunu çalışmasına rağmen hala aynı problemlere devam eden insanlar vardı.
And I didn't understand what was the difference between someone like me who responds well to training and someone like the people who do not respond well to training, or they do not develop as fast as they should.
Bazıları iyi cevap veriyor, bazıları antrenmanlara iyi cevap vermiyordu ya da gelişme olması gerektiği gibi gelişmiyordu.
So, the answer to why some people do not improve with some programs is actually very simple.
Bunun aslında sebebi çok basit. Neden gelişime cevap, yani bu iyi cevap vermedikleri nedeni çok basit.
And I think every athlete and coach should really be honest with themselves that not every single training program is guaranteed to work 100%.
Yani şu %100 antrenmanlar size garanti vermez bu gelişim için.
Because if every training program worked perfectly, or every rehabilitation program worked, then nobody would have injuries, everybody would be strong, we wouldn't have any problems.
Aslında bunlar eğer çok mükemmel cevap veriyor olsaydı herkes çok güçlenirdi. Bütün rehabilitasyon programları aynı o iyi cevap verirdi ve kimse de yaralanmazdı.
So this is Dr. Daniel Amen, and he has a really good TED Talk on YouTube. And at the time, there was 8 million views when I took the screenshot, but I'm sure there's more now. He's a psychiatrist, and him and his team did 83,000 brain scans.
Ve bu Daniel Amen ben izlediğimde 8 milyon görüntü görmüştü. Bir psikiyatrist 83 bin beyin taraması yapmışlar.
And what they found out is that exercises are like drugs. You need the right one in the right amount based on brain function.
Aslında egzersiz ilaç gibidir. Doğru onu almanız gerekir. Doğru miktarda almanız, beyin fonksiyonlara bağlı olarak doğru miktarda, doğru zamanda almanız gerekiyor.
So this is a picture of two patients. They have depression. So on paper, when they filled out the questionnaire, they have the exact same symptoms, and you would think that it's the same patient because all of their answers were exactly the same. However, when you put them in an fMRI machine and do a brain scan, this is how their brains look like.
Aslında iki insan semptomları da aynı ama MR şeyine koyduğunuz zaman ikisinin de görüntüsü farklı.
So the conclusion that Dr. Amen came to is that you can only prescribe people drugs based on their brain function, and you have to be able to see their brain function first.
Ve insanlara ilacı ancak beyin fonksiyonlara göre yazmanız gerekir ve o beyin fonksiyonları da görmeniz gerekir.
So having the same problems or goals does not mean that everybody should be taking the same drugs or doing the same exercise program.
Aynı probleminiz varsa ya da aynı amacınız varsa bunun anlamı şu değil. Herkes aynı ilacı ya da aynı egzersiz programı yapması gerekir diye bir şey yok.
So what I learned with the people at my gym is that they were getting stronger and fitter, but they were not becoming healthier.
Benim gym'deki insanlar güçlü ya da fit hale geliyorlardı ama bunlar daha sağlıklı hale gelmiyorlardı.
So those were the moments that were very important to turn me into the direction of neuro-athletic training because I wanted to get more answers.
Ben daha fazla cevap istediğim için bu yaşadığım olaylar, zamanlar beni bu alana, nöro-atletik antrenmana doğru itti.
And some of the answers started, yes.
I think the people are asking right now, what is the neuro-athletic training? Because they really wonder right now because
yeah,
you give many reasons right so far.
Yes. Well, now, so the next part is the aha moments, the parts where I start to get some of the answers.
Okay.
Yeah. So the first aha moment is like the light, the moment of light, I guess, is that moving your eyes is very, very important.
İşte şaşırdığı zamanlar birincisi şu, demek ki gözlerin hareketi çok önemli, göz bebeklerini hareket ettirmek.
And there's a question now in functional training where people ask, okay, stability versus mobility, which one is more important and which one comes first?
Birçok insanın ikilik yaşadığı ya da hangisine öncelik, stabilite, mobilite ikilemi.
So I give you a tip is that the brain's first priority is safety. And when something is stable, then the whole nervous system functions better.
What did you say last?
That the brain's first priority is safety. And so when something is stable, it is safer.
Okay. Beynin aslında önceliği en önemli şey güvenlik.
Kalemleri falan ayıracağız.
Eğer Eğer stabilite varsa daha güvenli bir ortam vardır. Okay.
Can I continue?
Yeah. Yes.
Okay. So this is a person named Martin, and you can just watch here. He's going to do some windmills, and you should really pay attention to the stability of his head, how it shakes a little bit, and the space between his shoulder and his head, the shoulder range of motion. And you can see for him that it's quite difficult to do. I'll play it again, and you can explain.
Tekrar oynatıyorum. Martin bu harekete bakarsanız zorlandığını
So he's going to do some eye push-ups right now. He's just following his finger.
Sadece parmağını hareket ettiriyor. Göz egzersizleri yapıyor.
So the eyes are coming together.
Ve gözler içe doğru bir araya geliyor.
And then without hesitation, he just does the exercise. And you can see that the shoulder position is much better now. His head is much more stable. His entire body is much calmer.
Omuzu daha rahat, başı daha stabil şu an bunu yaptıktan sonra.
From here again. So when you have the right neurological input,
doğru nörolojik girdiği sağlarsanız
the body just works better without thinking about it.
Düşünmeden daha iyi çalışmaya başlıyor.
Okay. So so what he was doing is convergence, a visual convergence exercise, which means the ability for your eye to fixate on a target and follow it towards you.
Aslında görsel egzersiz çalışıyor. Göz hareketleri bir noktaya fikse olarak çalıştırmış oluyor göz kaslarını.
So many people actually have something called visual convergence deficit.
Aslında birçok insanda bu görsel görsel fiksasyon yani yakınsama problemi var.
So this is the problem that Lena, this girl has, and she was in a car accident And she always has a lot of neck pain, tension, and she has headaches very often.
Bu araç kazası geçirmiş. Boyun ağrısı sürekli olarak, baş ağrısı var.
So if you just watch her, her left eye you should look at. And it starts to leave. So she doesn't know that her left eye doesn't follow the target.
Aslında sol gözünün hedefi takip ettiğinin farkında değil bu kişi.
And I would say about 25% of people I meet have this problem.
How many percent?
About 25%.
Yaklaşık %25'inde bu problem var. 25% of the people has this problem in public?
Yes, yes. I mean, if you go now and check it with yourself or your athletes over the next week, you'll find that very many people have this problem. They don't know that they have it.
Ve siz de çalıştığınız insanlara bakabilirsiniz. Yaklaşık 1/4'ünde bu problem var ve bunun olduğunun farkında değiller. Okay.
So there is, people ask all the time if there are studies on neuroathletic or on Z health. So in the case of Martin, for example, there is no study that says that your kettlebell windmill is going to get better if you do some convergence exercises.
Tabii şeye gittin, yani Nöro-Atletik and Z health, right?
Mm-hmm.
Gittiğinizde bununla ilgili çalışmalar da var, okuyabilirsiniz ama insanlar bunu tabii bilmiyorlar. Yani hani göz yakınsama egzersizleri yapıp ya da göz egzersizleri yapacağında o kettlebell egzersizini, antrenmanı daha iyi yapabileceğini kimse bilmiyor.
However, there's a lot of studies on the effects of having convergence deficits. A lot of studies.
What did you say a lot? A lot of studies with visual convergent deficit?
Yes.
Is affecting the working in gym?
It affects the following.
Okay.
So if you have convergence insufficiency, they say, people experience headaches, they have difficulty performing near vision tasks, such as reading or working on the computer. They have blurred vision, they have negative postural adaptations, and they have difficulty with catching and moving objects.
Aslında bu yakınsama ile ilgili yetersiz problem olanların çoğunda baş ağrısı, yakın işlemleri, işte kitap okuma, bilgisayar işi gibi yapama, negatif postural adaptasyon, objelerin takibi ve yakalanmasında ciddi zorluklarla karşılaşıyorlar. And it's really common. I'm really surprised right now. Is one of four people or athletes has a problem. So I just want to give an addition. Something, if there's a really basketball, volleyball, or soccer player, and if it's an conversion insufficiency, so difficulty with catching or tracking movement objects. So think about that. If it is the goalkeeper, so it's really affecting his performance.
Yes, definitely.
1/4 eğer bu problem varsa gerçekten çok ciddi problem. Çünkü yakalama, takip etme, objeyi takip etmede ciddi problemleri yaşıyor. Herhangi bir spor branşıyla uğraşan için bu çok önemli bir aslında eksiklik. And we know that we can improve this insufficiency to the sufficiency, right?
Yes, yes. It's actually most of the time not too difficult.
Bazen aslında bunu çözmek hiç de zor değil yani çoğu zaman bu yetersizliği. Okay.
Yeah. So you can imagine in sports that if only one eye is tracking the ball, then this eye always becomes the favorite eye, and you have postural adaptations so that this eye always has the advantage.
Düşünün, bir göz sürekli avantajlı haldeyse postural adaptasyonu da ona göre oluyor.
So visual convergence also helps in midline stability and in strength.
Ee,
So
Bu yakınsamadaki aynı zamanda orta hat stabilitesinde de önemli bir yer teşkil ediyor.
So if you watch here, she's doing a side plank. You should see that she uses her whole hand and how far away her leg is from the floor.
Ve yan plank yaparken ayağını topa doğru kaldırmaya çalışıyor.
It's very difficult for her to raise her leg any higher than this.
Bu şeyden yukarıya kaldırmak çok zor onun için.
So she's about to do an exercise now. So these videos are very old because
Bu
this was when I
video çok
first started.
eski. Bu
When I
ilk
first
başladığım
started
zamanlar
learning.
benim.
So he's twisting her now, and she's holding against the force or the torque.
What did you say?
So he is twisting her body, he's grabbing her shoulders, and he's twisting her, and she's resisting the rotation. So she's doing an anti-rotation hold.
Şimdi bu aynı zamanda anti-rotasyon tutuş yapıyor. Bir tarafa döndürmeye çalışırken o da ona karşı direnç sağlıyor. Okay.
And at the same time, she's doing this convergence exercise.
Aynı zamanda bu yakınsama egzersizini yapıyor.
So she doesn't have the problem of one eye moving, which is good.
Bir tanesinde problem yok gözünün. Which eye is problem for her?
She doesn't have it. Hers is healthy.
Is she healthy or she doesn't have a problem, right?
No.
Okay.
So you can see now that the exercise is much easier for her. She's just using her fingers, and her leg is much further off the floor, and her leg is so much higher now.
Şimdi daha yükseğe kalkıyor ve aslında daha kolay yapıyor. I just want to make clear that she doesn't have any problem, right? Before
No.
using that. Okay.
No, she doesn't have any problems.
She's in 75%.
Yes, actually, no, she had problems before, but she trained it, so it got better.
Okay. Önceden vardı ama çalıştı diyor.
So these exercises, these neuro exercises, are also used as activation exercises.
Bu nöral egzersizler aynı zamanda aktivasyon egzersizleri aslında.
So just show the video again. And now she doesn't need to use her hand anymore.
Ellerini şimdi kullanmak zorunda değil. Çok fazla. Oh.
And it's much better.
Ve daha iyi yapabilir hale geldi.
So the visual system also has a huge effect on strength.
Görme sistemi aslında kuvvet üzerinde de çok önemli bir etkisi var.
So this girl, she works for me, and she's just explaining that she was trying to get her first chin up.
Bu benimle birlikte çalışıyor ama chin up barfix'te çok zorlanıyordu.
So she's just explaining that she couldn't do it, and then she did some eye push-ups, and then she could do her chin up.
Önce bu göz push-up'ını yaptı. Gözleriyle çalıştı.
So she videotaped it. This is her
Sonra
trying to
videosunu
do.
çekti.
She can't get past this 90 degree.
90 dereceyi geçemiyor.
And she's trying. She can't get it. So she's doing the convergence exercises with one eye.
Bir gözüyle birlikte. Which side is problem for her?
Both sides, but more the left side. So she does left, right, and then she does both of them.
Önce sol, sonra sağ, sonra iki tarafta da çalıştı. Yeah.
And it's her first one ever.
Bu da ilk kez yaptığı, ilk kez bunu yapabildiği.
So now most of you are probably asking, how does this work? Why does it work?
Şimdi aslında bu neden çalışıyor böyle? Nasıl etkiliyor?
So everything about neuroathletic or Z health is based on neuroanatomy.
Aslında bunların hepsi nöroanatominin altında gizli.
So here is a diagram of two different spinal tracts called the tectospinal and the interstitiospinal tract.
İki tane yol var. Spinal
So
yol arkada.
So maybe this will be hard to translate, but when you move your eyes, you activate a part of your brain called the superior colliculus.
Aslında gözlerinizi hareket ettirdiğinizde çekirdekler var beyin sapındaki. Superior collicus çekirdeğini aktive ediyorsunuz.
And what happens is through this visual stimulus, it starts to activate the tectospinal tract, which sends neural signals to the lower motor neurons in the neck musculature.
Bunu aktive ettiğinizde bu superior collum aktive olduğunda bu tract. What is the name of the tract? Tractus spinalis?
Tectospinalis.
Tractus spinalis. Tektospinal
Yes.
yol aslında bu görsel sistemle ilişkili bir yol. Görsel sistem aktive olduğunda buradaki çekirdeklerden spinal yola özellikle de boyun kaslarının aktivasyonu sağlanmış oluyor.
So remember when Martin was doing the kettlebell windmill, his head was very shaky at the beginning, and then afterwards his head was very stable.
İlk hatırlarsanız o kettlebell'i kaldırırken boynu çok sallanıyordu, titriyordu ama yaptıktan sonra boynu daha stabil hale geldi.
At the same time, signals are also sent through the interstitiospinal tract.
What is the name of the spinal tract?
Interstitio. Interstitiospinal tract.
Okay. Interstitiospinal yol, o da diğer bir yolak.
And this
Nöroanatomide aslında yol demek. Tam o duyamadığım şey, beyinde başladığı yol, çekirdekten spinal, yani interstitiospinal, diyelim ki beyindeki çekirdekten spinal tarafa giden yola tanımlar.
So it also sends signals to the lower motor neurons of the neck musculature, as well as the torso musculature or the proximal musculatures of the trunk.
Aynı zamanda boyuna gittiği gibi gövdenin de proksimal kas gruplarına uyaran gidiyor.
So this is very important because very often as trainers, we are of course focused on gaining stability of the trunk, of the midline.
Aslında biz orta hatta core stabiliteden bahsederiz. Omurganın orta hattındaki stabiliteden trainerlar olarak.
So we do all kinds of exercises like planking and sit-ups and anti-rotation holds.
Birçok egzersiz yaparız bunlar için. Plank, anti-rotasyon, işte side plankler vesaire.
However, the musculature of the midline is actually activated reflexively or automatically through visual stimulus.
Aslında bu orta hat refleksif olarak görsel uyaranlarla aktive olmuş olur. Tektospinal yoldan.
So if you don't integrate visual exercises into your midline training, then you're never really activating the neurological system that regulates this.
Siz eğer görsel bu egzersizleri antrenmanınıza eklemezseniz hiçbir zaman bunu aktive etmiş olmayacaksınız.
So just to bring it back, that aha moment number one is that moving the eyes is very, very important.
Gözlerin hareketi, gözlüklerin hareketi o yüzden çok önemli.
Aha moment number 2, moving the head is very important.
Başın hareketi çok önemli.
So we all know that balance is very important, but where does balance actually come from?
Balans, denge nereden geliyor?
So this is an animation
Bu
of
animasyon,
your vestibular system.
vestibular sistemin animasyonu bu.
That's the actual size compared to your eyes.
Gerçek taraflar, yani hani gözlere göre gerçek durumuydu.
There is an activation inhibition process.
Aktivasyon ve inhibisyon prosesleri.
So when you rotate your head left and right, you activate the different canals, and you have 3 different canals on each side.
Her tarafta 3 tane farklı kanal var. Sağa sola hareket ettirdiğinizde bu kanalları aktive etmiş olursunuz.
So your vestibular system actually controls or regulates extensor tone.
Vestibular aktivasyonunda ekstensör tonusu kontrol eder.
This is Ina.
Bu Tina. Bu.
So the task is to touch the hand of Felix without falling over. And this
eline değdirmek ayağını burada.
And this is already her 4th time trying, and it's very difficult for her.
Deneyip duruyor ama başaramıyor. Bunu yapmak onun için çok zor.
And she can't reach the foot. So now she's going to do a vestibular activation, and she basically just tilts her head to the side. And when you tilt your head to the side, you activate all of the canals.
Başını sağa doğru hareket ettirdiğinde bütün kanallar aktif etmiş oluyor.
And fixating her vision is a very important part of the task.
Görsel odağın sabitlenmesi de çok önemli.
And so she's going to try again now. And now it's very easy for her to control her leg, her balance. Everything is much smoother and more calm. Ta-da. Cool. So, how does this work anatomically?
Bu anatomik olarak nasıl çalışıyor peki?
So we have something called the vestibulo spinal tracts.
Vestibüler yollar var omurgaya giden.
When we move our head in a rotation, or we move our entire bodies in a rotation, or we tilt our heads, they're called angular movements.
Açısal olarak başımızda hareket ettiğimizde ya da rotasyon yaptığımızda
we activate the semicircular canals. So in the animation, you saw the activation of the canals.
Bu semisirküler kanalların aktif olduğunu görürsünüz.
However, when we move up and down or side to side, we activate something called the otolith organs.
Ve başımız aşağı yukarı ya da yana doğru hareket ettirdiğimizde de otolit organı da hareket ettirip aktive etmiş oluruz.
So then these send signals to the vestibular nuclei.
Bunlar vestibüler çekirdeği gider, uyaranlar.
And then the different vestibulospinal tracts are activated. You have a medial and a lateral vestibulospinal tract.
Medial ve lateral vestibüler yolaklar var, vestibülospinal.
So it inhibits flexor muscles and activates extensor muscles.
Fleksör kasları inhibe eder ve ekstensör kasları da aktive eder.
So all of the musculature on the posterior side of the body is turned on when the vestibular system is active.
Vestibüler sistem aktif olduğunda posterior chain'deki bütün kaslar aktif olur.
So you can imagine that for athletes who have a lot of difficulty sprinting very fast or getting a triple extension, that they could have deficits in their vestibular function.
Eğer birisi hızlanmada ya da triple extension'a gelmekte zorlanıyorsa vestibüler sisteminde problem olabilir. And also you can improve this function, right?
Yes.
I mean, if you have on your right side a problem, vestibular function, so you can improve it. I just want to ask, how are you going to testing the vestibular function, right and left? You can see the eye conversion like easily, but
Right. Yes.
how do you test the vestibular on which side is better? How can you test it?
So sometimes you can tell from just doing balance tests, or you can see that the musculature is better on one side than the other side. And then the other way to test is usually we do it through visual tests as well, because the vestibular system is supposed to stabilize the eyes when you're moving. So when a person is looking at a target and they tilt their head to one side, if the clarity, the visual acuity changes, you know that they have a vestibular problem on this side.
Evet. Birkaç şekilde bakabiliyoruz. Bir tarafta kas şeyleri daha gelişmiş oluyor. Bozulmamış olan tarafta. And the balance is a problem on the side which is not functioning properly, right, for the vestibular system.
Normally, you can see it through muscle tone as well.
Yeah, I mean, if you can test it on right and left side balance, so if there's a problem on the right side, so you can say that on his right vestibular function could be a problem, just basically.
Yes. Yes.
And also muscle tonus, denge egzersizinden, ondan sonra kas tonuslarından ya da fikse edip işte baş hareketi yaptırdığınızda hareket ettirirken bir tarafta görüntü bozuluyor. O bozulan tarafta da yine vestibüler fonksiyonlar aslında ilişkili olduğu için orada problem, yani o tarafta problem olabilir. Gözde test ediyoruz, işitmede nasıl test ediyoruz problemli tarafı diye. Okay, go ahead please.
So I worked with one professional hockey player. He had a hamstring injury and he rehabilitated the hamstring. So he has absolutely no pain or no problem skating anymore, except that he never really regained the strength in that side. And this side of his leg was noticeably smaller than the other side of the leg.
Evet. Bir tane bu hockey sporcusuyla çalıştım. Her şey yerine geldi ama bir taraf diğer tarafa göre, yaralanmış taraf diğer tarafa göre fark edilir düzeyde kuvvetsizdi.
So we tested his vestibular system and he had deficit on the same side. That was the problem. But we also had to do some muscular mapping to connect the vestibular system with the muscle again.
Ve tekrardan vestibüler sistemi test ettiğimizde bu tarafta problemliydi. Tekrardan buna uygun eşleştirme yapmamız gerekti vestibüler sistemle o kas grubunu.
So then he did his preseason.
Then you design a special program for this guy, right? To connect the vestibular system and muscle group on the problematic side.
Yes, yes.
Okay.
He then did his, they do preseason testing for the team. Okay. And because he's a left winger, of course, one of the legs is always stronger than the other leg because they're always turning mostly in one direction. Okay. And after he does this vestibular program of mine, then he did the preseason testing, the strength testing, and the results were that both his legs were equally strong now.
Tekrardan çalıştıktan sonra sezon öncesi testlerin yapılırken hemen hemen iki tarafta eşit derecede güçlü eşit seviyede çıktı.
And this never happened before for him. And he's a professional.
Bu önceden bunun için hiç olmamış bir şeydi ve bu profesyonel bir buz hokeyi sporcusuydu.
So you can see here in the textbook and all of the stuff that you can, all of the, basically the topics or the principles of neuroathletic, you can find in any neuroanatomy textbook.
Bunu herhangi bir nöroanatomi kitabında bulabilirsiniz, okuyabilirsiniz de.
So here you can see that the vestibular tract works with the reticulospinal tract to control, posture and muscle tone. There we go.
Burada gördüğünüz gibi vestibulospinal yolak tonus ve postürü kontrol etmek için retikulospinal yolda birlikte çalışır. Okay.
So it is associated with the proximal extensor musculature.
Aynı zamanda proksimal ekstensör kas yapısıyla ilişkilidir.
And the vestibular spinal tracts help to promote body and head movements to maintain appropriate posture with vestibular activation.
Vestibular aktivasyonla bu vestibulospinal trakt yol beden kontrolünü, beden hareketlerindeki uygunluğu, devamını sağlar.
That means that the vestibular activation starts this whole postural adaptation. So even if you train the muscles and the muscles become bigger through bodybuilding or strength exercises, it doesn't mean that the muscle works when it's supposed to work if you have some kind of vestibular deficit.
Yani sizin kaslarınızı güçlendirmiş olmanız yetmez çünkü bunların vestibulospinal sistemle eş zamanlı uyumlu olarak çalışması gerekir.
So this is a good example of posture. She is one of my clients.
İyi bir örnek.
She used to play in the second league Bundesliga for table tennis.
İkinci ligde oynuyor masa tenisinde, Bundesliga'da.
And she is, as her second career, she is a law professor.
Was it law professor, right?
Yeah, professor for law.
Hukuk profesörü.
Mm-hmm. And she is very allergic to wasps.
What is it?
Wasps, the bee, a big bee.
Okay. Büyük arılara karşı ciddi alerjisi var.
So she got stung by a bee. She had a heart attack. Her heart stopped. They reanimated her.
Aslında kalp krizi geçirmiş.
And after this, she did all the physiotherapy, but she still was unable to stand for a long period of time without feeling dizzy, and she couldn't look at a room full of people. And you will see now how she walked.
Uzun süre ayakta kalmakta zorluk çekiyor ve baş dönmesi yaşıyordu. Şimdi göreceğiz.
So you can see that she waddles when she walks. Her feet are pretty far apart, and she always looks at the floor. So this is very common for people who have vestibular problems.
Vestibular problemleri olanlar için bu yürürken kontrol, dengeyi sağlayamamak, ölmek çok sık karşılaşılan bir problem.
So I tried to do conventional training with her. So I tried to have her sit in a chair, stand up a couple times, do some squats, do some presses on a table, like progressed push-ups. However, her physical reaction to them was so negative. She felt terrible the day of the training and the day after the training.
Öncesinde birkaç böyle işte sandalyeye oturup kalkma ya da hafif push-up'lar yaptırdığımda çok zorlanıyordu. Antrenmanı da çok zor geçiyordu.
So then I decided to only do neuro training with her.
Ve sonra sadece onunla nöral antrenman yapmaya karar verdim.
We did a lot of breathing exercises. We did a lot of visual and vestibular exercises.
Çok fazla nefes, görsel ve işitsel egzersizler yaptık.
But we also did a lot of brainstem exercises, which includes humming and tongue exercises.
Beyin sapı ile ilgili egzersizler yaptık.
And this was very, very important to get her stability back.
Bu onun stabilizasyonunu kazanmak için çok önemliydi.
So just, if you see the video again, that her posture is forwards, the upper back is rounded.
Üst tarafı yuvarlak bir şekilde.
And this was after about 8 months of training.
8 aylık antrenmandan sonra.
So you can see that her posture is almost completely straight now.
Şimdi gördüğünüz gibi postürü neredeyse dikeyleşti iyice.
She lost weight without changing anything in her diet.
Kilo kaybetti.
Her feet are much closer together and her walking is so much better now.
Şimdi yürümesi daha iyi.
So I did not do any strength training with her and only neuro training, and her posture changed.
Hiçbir kuvvet antrenmanı yapmadım onunla ve sadece nöral antrenman yaptım. Postürü değişti.
So even though I work with professional athletes, it's actually with the most compromised people or the people who were the sickest that I learned what the essential systems for movement were.
Yani sadece bunun için değil, aynı zamanda sporcular için de aslında sistem için gerekli olan bir şey.
So aha moment number 2, you're moving your head is very, very important.
İkinci şey neydi? Başınızın hareketi çok önemli.
Aha moment number 3, proper rehabilitation is not just physical.
Üçüncü şey fiziksel rehabilitasyon, uygun rehabilitasyon için uygun rehabilitasyon sadece fiziksel değildir.
So I'm going to share with you a concussion rehabilitation case now.
Şimdi de konküzyon rehabilitasyonunu paylaşacağım. Yani beyin travması.
So this is another hockey player that I worked with. He plays in the first league here in Germany.
Yine bu buz hockey oyuncusu 1. ligde oynuyor Almanya'da.
And here is the hit that he got. That's him here.
Orada düşen o.
So he's skating and he gets blindsided.
Oh.
And he knows immediately something's wrong.
Ve hemen fark etti bir şeylerin onda yanlış gittiğini kalktıktan sonra.
So his head hits the sideboard.
Kafası yandaki şeylere çarptı, koruyuculara.
So when he met me, hold on a second.
Benimle tanıştığında.
Sorry. So when he met me, it was he couldn't see properly. So if he looked at his phone screen, all of the letters, all of the pictures would blur.
Görmesi bozulmuştu. Göz taraması yaptığımızda bulanık görüyordu.
And he was having headaches, but he didn't need to vomit or anything.
Ve baş ağrısı vardı.
And this was 4 weeks before he was supposed to go to the Nationals training camp.
National?
Yes. So for the German team.
Okay. Bu yaklaşık 4 hafta önce gerçekleşmişti milli takımı gitmeden önce bu dönem.
So here in Germany, the concussion rehabilitation protocol is not as good as it is in Canada and the US.
Bu konfüzyon rehabilitasyonu burada Kanada'daki gibi değil. Protokol.
So this is the protocol that he gets. There's 6 different stages, and you start off with light aerobic exercise, which means first no activity, so you rest first, doing nothing. And then after that, it's light aerobic exercise. You get to be on the bike for 20 to 30 minutes. There's no on-ice activity. Once you pass this stage, you pass. A pass is considered when you don't have any symptoms. That means your vision doesn't blur. That means you don't have any headaches. That means you don't feel like vomiting.
Bu aşamaları yani 20-30 dakika önce hafif aerobik egzersiz, bu aşamaya geçmesi için de herhangi bir baş ağrısının ya da görme sorunun olmaması gerekiyor bundan sonra.
And then you start to go into sport-specific exercises, so some light body weight training. Then you have some on-ice activity. You do some aerobic training and some technical training on the ice. And then it goes on like this.
Bu üzerinde aktiviteler, hafif kuvvet antrenmanları, beden ağırlığında, hafif düşük yoğunlukta koordinasyon egzersizleri.
So basically, there is no vestibular rehabilitation, there is no visual rehabilitation, which is what they do in Canada and the US.
Herhangi bir vestibular bir görsel şey yok bu protokol içerisinde. Amerika ve Kanada'da olduğu gibi.
And so it's basically just a waiting game, a resting game until the symptoms go away. And basically the physical tests that they do, which from light aerobic to heavier weight training, is just an indication of whether or not the symptoms have gotten better.
Hafiften işte iştekliğe doğru kuvvet antrenmanları, herhangi bir semptomun olmaması yeterli görünüyor.
So he contacted me because he wasn't getting better. And we started, yeah.
Benimle kontak kurdu çünkü iyiye gitmemişti.
So we started with sensory deprivation, which basically meant a lot of light reduction and a lot of resting.
Çok fazla dinlendiği. What do you mean with sensory deprivation?
Just reducing stimulus.
Okay. Burada çok fazla dinlendiği ve uyaranın azaldığı bir dönem yaptık. Girdinin yani duysal girdinin azaldığı bir dönem. It means it's more visual, right? Visual deprivation.
Also sound.
Also sound. Okay. Görsel ve işitsel yoksunluk oluşturduk. Okay.
And so for some professional athletes in the States, they actually have sensory deprivation. They call them tubes. They sit in a room and there's no light and there's no sound.
Odaya giriyorlar, hiç görsel bir şey yok, ses yok.
And he did what he could in his home. So he wore dark glasses and different colored glasses all day. And he tried to reduce all of the sound stimulus. So when he's watching TV, for example, or resting, he's looking at something, but he's not listening to anything.
Ya da diyelim ki bütün uyaranlar azaltıyor. Televizyon izliyor ama sesi kısıyor. Ses yok. Ondan sonra çeşitli gözlüklerle görsel uyaranları da azaltıyor. Okay.
And we had to do a lot of breathing exercises, and he had to increase the number of calories that he was eating.
Nefes egzersizleri, and also you did a calorie limited calorie?
No, increase. He ate 3 times as many calories as he normally does.
Kalori miktarını artırdık, aldı.
Because what happens after concussion is that your brain is trying to repair itself, and the brain is only using 2 sources of energy, oxygen and glucose.
İki şeyi kullanıyor beyin, onların esnasında oksijen ve glukozu.
And so we had him drinking juice with the highest density of glucose possible. Everything in every single meal, we try to increase the calorie density of each meal.
Kalori yoğunluğunu artırdık her öğünde.
And he didn't gain any weight.
Hiç kilo almadı.
So the reason why we had to start with all this was because he was not able to do any visual or vestibular exercises because he couldn't see well. He couldn't see well enough. Everything would blur, and specific head motions would also make his vision blur.
Çünkü bunda gerçekten görsel bir problem vardı. Her şey bulanık görünüyordu ve spesifik baş hareketlerinde de problem yaşıyordu.
So his case is actually very intensive, and
Aslında çok yoğun bir süreci vardı.
we had to first activate something called the optokinetic reflex, which helps to stabilize his neck.
Optokinetik refleks egzersizleri yaptık. Bu daha çok boynu stabilize ediyor.
Because we also started to do everything also first in a general sitting or standing position, but eventually we needed to transfer everything into a hockey specific position.
Önce otururken ya da dikilirken, sonra da her şeyi buz hokeyindeki spesifik pozisyonlara göre dizayn ettik.
This is because at some point his symptoms got better on the ice and off the ice. However, once he got into the position that he got hit from, he started to have problems again.
Problemleri iyileştiğinde, tekrardan o spesifik pozisyonlara geldiğinde tekrar problemleri ortaya çıkmaya başladı.
So we did multiple exercises with some apps. This app is called the Focus Builder, and you can set it up to have different visual exercises.
What's the name of the app?
Focus Builder.
Focus Filter diye odaklanmayla ilgili bir aplikasyon üzerinden çeşitli egzersiz programları dizayn ettik.
So these three dots, for example, this task in particular, he's supposed to look at the middle dot, the black dot, and then one of them would blink, and he's supposed to jump his eyes to the opposite one, so the one that did not blink.
Bir tanesi kapalı, kör nokta, bir tanesi açık. Göz hareketlerini işte oraya doğru odaklanmasını sağladık.
So unfortunately, the first time he did this exercise, after about 5 seconds, he felt like he was going to vomit.
İlk yaptıktan sonra kusacak gibi oldu.
And this is another example of the exercise. At some point, for example, if he did this exercise where you're supposed to follow the target, he could only see it clearly if it was this shape, a U shape.
What do you mean?
So you see the letter on the...
Yes, yeah.
Yes, if it was a line, he couldn't see it.
Çizgi haline geldiğinde göremiyordu.
So in order to rehabilitate this visual function of being able to follow an object, we had to use this C shape first.
Görsel fonksiyonlarını yerine oturtmak için bu C şeklini kullanıyoruz. Çünkü çizgi haline geldiğinde göremiyordu.
So this is obviously very important if he's following a puck, that he's able to see the puck well when he's playing.
Bu giderken bunu takip edebilmek, görebilmek de önemli bir durum.
So then we started doing vestibular rehabilitation, and at the beginning it was just, At the beginning, it was just him moving his head back and forth, looking at something, and making sure that he can maintain visual fixation.
Görsel fiksasyonla birlikte baş hareketlerini yaptık en başta.
So all of the head motions are in different angles to test that and train that each canal is working properly.
Aslında buradaki amacımız her kanalı aktive etmek.
And that, of course, the neck musculature, that the motion is clean, and then you know that the neck coordination is also good.
Aynı zamanda boyun kas koordinasyonunu da sağlamış oluyorsunuz.
So he started first standing, and then he started doing it in the position that he got hit in.
Tekrardan buz hokeyin spesifik pozisyonunda bunları yaptırıyoruz.
So aha moment number 3 is that proper rehabilitation is not physical. And in the end, with the hockey player, this guy, Dominic, it was very successful because we did 4.5 weeks of very intensive training. He did his exercises every hour or every 2 hours. And then he had to sleep or eat or use the dark glasses to recover from all of the neuro exercises.
Buradaki üçüncü şey de bu aslında fiziksel egzersizin sadece yeterli olmadı. Yaklaşık 4-5 hafta bu oyuncuyla yani günde 1-2 saat, her 1-2 saatte yapacak şekilde bu nöral egzersizleri ona öğrettik. Görsel girdilerini kısıtladık, işte kalorisini arttırdık.
And we know that it was successful because he ended up going to the national team training camp. So he played for Team Germany.
Milli takıma gitti, başarılı oldu çünkü sonunda milli takıma gitti. Tekrardan kampa katıldı.
And so he had a few practice rounds and there was a couple hits which was totally fine. And then in the first match against, I think it was Czechoslovakia or Slovenia, he got some really hard hits and he had absolutely no symptoms. He had no neck soreness. And so everything was very good.
Ve ilk birkaç antrenmanını yaptı. Hiç problem olmadı. Sonra Çeklere karşı maç oynadı. Çok sert maçtı ve hiçbir problem yaşamadı maçta da.
And the following year in the regular season, so the first league in Germany, he got a specifically like a very bad hit where he felt a little bit of a headache afterwards. And he was very scared, of course, that all of the old symptoms would come back.
Sezon içerisinde arkadan darbe aldı, biraz baş ağrısı oldu. Tekrar eski semptomların gelecek diye çok korktu.
And I said, just do some of the visual exercises that we had done, test them, and if there's anything funny, then we can continue to monitor it. However, he did the exercises, he had no problems with the exercises, and the next day he felt totally fine again. So all of the stabilization work that we did, it held until then.
Birkaç tane o göz egzersizlerini yaptı, problemi olmadı. Ertesi günde iyileşti. Bu bütün yaptığımız önceden aslında ona gerçekten ciddi katkı sağladı yaptıklarımız.
So, next, how can you integrate this into your life? So obviously in 2 hours, there's not a lot that I can teach you except to start understanding the basic principles of how to think first.
Tabii ki 2 saat içerisinde benim size bütün bu şeyi anlatmam çok mümkün değil. Sadece bu konuya giriş yapabiliyorum. Bunları hayatımıza peki nasıl adapte edeceğiz?
So let's get into integration and flow. So the best way you can start with your athletes and with yourselves is having an excellent warm-up.
Bir tanesi aslında mükemmel bir ısınma.
But first you have to understand how the nervous system works.
Bir tanesi, önemli olan bir tanesi sinir sistemi nasıl çalıştığını anlamak.
And very simply, your nervous system only does 3 things. The first thing is that it receives sensory information. It takes this information, it integrates it, it makes decisions, and then you have a relative motor output.
Önce duyusal girdileri alırsınız, çeşitli görsel, işitsel ve proprioception. Sonra bunları işlersiniz, bu bilgileri ve bir motor gir çıktı oluşturursunuz.
So your coordination, your strength, your flexibility, or pain is only number 3, the last part. It is a result of the other 2 steps.
Aslında sizin koordinasyonunuz, dengeniz, kuvvetiniz hepsi diğer iki şeyin çıktısı. 1 ve 2'nin çıktısı.
So if you have some kind of technical failure, or if you have difficulty in learning a new technique or maintaining the technique, you know that either you're missing sensory information or the integration of the inputs is not good.
Eğer bir tekniği öğrenmede başarısınız varsa burada ya duysal girdilerinizde ya da bunları işlemede probleminiz vardır.
So pain is also an output.
Ağrı da bir aslında sonuçtur.
Pain is actually an action signal from your nervous system saying that something is not correct, or something is wrong, or the threat level is too high.
Bu ağrı şu demektir, ya bir şeylerin bedeninizde yanlış gitti ya da bedeninizde korkunun fazla olduğunun göstergesidir.
So if we want to improve the output, the motor output, we should really focus on the first two steps.
Eğer motor çıktığı iyileştirmek istiyorsanız 1 ve 2. adıma odaklanmanız gerekir.
So we have different systems that provide the sensory input. We have the visual system, the vestibular system, and the proprioceptive system.
Duysal olarak 3 farklı girdiği şeyimiz vardır. Görsel, işitsel ve propriosepsiyon.
So if you want to improve visual inputs, then first you have to understand what are the different visual skills.
Görsel şeyinizi arttırmak istiyorsanız hangi farklı görsel şeylerimiz var, yeteneklerimiz var?
So you basically have 5 different visual skills. Gaze stabilization.
5 farklı şeyiniz var aslında, görsel yeteneğiniz.
Which means to be able to fixate on a target.
Ya bir hedefe fiksasyon yapabilmek.
You have peripheral vision.
Peripheral görme alanı.
You have near-far accommodation, so being able to, your eyes, the lenses of your eyes to accommodate to look at something near to you and something far away.
Uzak yakın uyumu.
Visual saccades is the ability to jump your eyes from different targets.
Farklı hedefler arasında görsel odaklanabilme.
And then visual pursuits is the ability to follow objects.
Ya da bir objeyi takip edebilme.
So, of course, at a sports level, you can understand how all of these visual skills are very important. However, for the average person, it is also very important. So all these skills are needed when you drive. And if these skills are insufficient and you continue growing older, it has a lot of negative effects as you age.
Ve aslında bu hem sporda hem de günlük hayatımızda çok önemli. Yaşlandıkça eğer bunları kaybediyorsak bizim için daha zorlu hale gelecek.
For an athlete, it means a much higher risk of injury, but it also means a much higher risk of injury for older people as well.
Hem sporcu için hem de yaşlandığınız zaman bu yaralanma riskinizi artıracak bir durum yaşlı insanlar için de.
So here is an exercise for peripheral training.
Bu peripheral görme alanı için bir egzersiz.
So this woman, her task is to look straight ahead and walk around the boxes using only her peripheral vision to orientate herself.
Peripheral çevresine odaklanarak sadece düz bir şekilde bakarak bu box'ın kutunun etrafında dönüyor kadın.
So you can see the tensioning of her hand now. She has to look at the box, even though I put some orange stuff, a foam roller, and some pylons on it. It's very difficult for her to see.
Benim o box'ın üzerine koyduğum foam roller'ları görmek bile onun için görmekte çok zorlanıyordu.
And what's interesting is that she came to me with knee pain.
Ve enteresan olan şu, bana diz ağrısıyla gelmişti bu.
So, like I said, pain is actually an action signal from your nervous system telling you or trying to tell you that the level of threat is too high.
Ağrı aslında şu, sinir sisteminden gelen vücudunuzdaki korkunun fazla olduğunu göstergesi.
And you can imagine that for a woman like her, when you have very poor peripheral vision, your entire environment is a threat all of the time.
Say again.
So for a woman who has very bad peripheral vision, she cannot see the floor, she cannot see around her, the nervous system is constantly under stress.
Ve bu periferal görme alanı daralmış bu şey için insan için aslında sinir sistemi sürekli bir tehlike altında hissediyor kendini.
And so the nervous system produces pain in order to try to tell you that you need to change something.
Ve sinir sistemimize ağrı oluşturarak size bir şeyler ifade etmeye çalışıyor.
So this is not the only exercise I did with her, but I helped her successfully get rid of her knee pain without actually doing any knee exercises.
Herhangi bir diz egzersizi yapmadan onun diz ağrısından kurtarmaya dizayn ettiğimiz bir egzersiz programı.
So for more healthier people, you can also integrate it into training like this.
Sağlıklı insanlar için de bunu entegre edebilirsiniz.
It's a more difficult pattern because they're going backwards a little bit.
Bu çünkü yani hem ön arka gittikleri için zor bir patern.
And for athletes, you can do different variations
Sporcular için
like this.
farklı varyasyonlar sağlayabilirsiniz.
So this is my sister, actually. She played very high-level women's soccer in Canada.
She's looking straight ahead when she's
supposed to look straight ahead. She wasn't doing it 100% correct.
Right?
She's supposed to try and look straight ahead, but she was looking for the cones. But she's not supposed to look at me.
Bana bakmaması gerekiyor. Karşıya bakarak bu şey yapması gerekiyor. Sprinter.
Yeah. So integration element number one is that you should first do a good warm-up. And what does a good warm-up mean?
İyi
I don't know.
gerekiyor entegrasyon için.
This writing here, I don't know how come it's there, but it's not mine. Okay, so you have different aspects of a very good neuro warm-up. And first you need respiratory activation. You need sensation activation, vestibular activation, visual activation. Then you can start your joint preparation, and then you can do exercises that integrate all of them.
Evet. Önce respiratuar aktivasyon yapmanız gerekiyor. Sonra sensörel aktivasyon, vestibular aktivasyon, görsel aktivasyon. Just could you come back for this one?
Sorry?
Could you do zoom out, please?
Yeah.
Vizüel aktivasyon, eklem hazırlığı ve integrasyon egzersizleri.
So for respiratory activation, you can do things like diaphragm stretching or rhythmic breathing.
Diaphragm stretching, ritmik solunum, respirasyon için. Okay.
Sensory activation, so the receptors on your skin. So if you do this kind of motion, it's a rubbing action. It's a different kind of receptor than if you do foam rolling or if you do this kind of activation.
Foam rolling yapmak ya da takviye uyanlarını vermek, ellerinizi yapmak, bunlar da ayrı şey.
Vestibular activation means you have to move your head in every single angle that activates all 6 canals.
With fixation, right?
You can do both, with and without.
Yeah, with I mean, what about the eye with fixed eye movement, or you can change the eye movement when you're rotating your head?
You can change it because athletically you need to do both things, right? So when you're playing a sport, you have to be able to watch somebody or an object and move at the same time. But sometimes you have to move and follow the ball at the same time. So you have to do all of it.
Hepsini yapmanız gerekiyor. Hem fikse olarak hem de fiksasyonunu bozarak, yani baş hareketi, göz görme alanını takip ederek. Okay.
And also you have to activate the otolith organs, so moving up and down, but also in all linear directions as well.
Otolit organlarınızı da aktive edebilirsiniz. Apan sıçrayarak ya da farklı yönlerde hareket ederek.
So for the most part, teams and coaches, they do jogging as a warm-up, and sometimes they do lateral shuffling and backwards running, hopefully, but most people don't do these kind of angular head motions.
Ama lateral shuffling ya da back foot, geriye doğru koşularak yaparak aslında bunların aktivasyonu sağlanıyor ama baş hareketleri yapılmamış oluyor.
So you also need to do a visual activation. So all of the, I forgot the peripheral vision should also be on here. All of the 5 different skills that you need to do without making it so specific in an exercise with other teammates first.
Spesifik yapmadan diğer takım arkadaşlarına bu bütün görsel aktivasyonları yapabilirsiniz. 5 farklı az önce belirttiğimiz. Takip etme, işte hedef değiştirme, göz hareketleri, yakın uzak adaptasyonu vesaire.
Then there's joint preparation. So you have to basically warm up every single joint that you need, except it's very important that you do it more sports specific.
Spor spesifikten ziyade bütün eklemlerinizi hazırlamanız gerekiyor.
So for example, if you're a volleyball player and you have to do, you're a hitter. Okay, so in this hitting position, you should do some shoulder articulations, elbow articulations, wrist articulations, thoracic spine articulations, etc.
Voleybolda smaç vuransanız, smaç ne diyorlar hatırlamıyorum. O smaç pozisyonda omuz, el bileği, ondan sonra toraks yine hazırlığını yapabilirsiniz, aktivasyonlarını.
Basically, what you try to do is you activate all of the mechanoreceptors around the joint. It sends information to your brain as to the position of the joint, and then it should be able to coordinate the limbs much better.
Çünkü o pozisyonda mekanoreseptörleriniz uyarak beyine göndermiş oluyorsunuz ve daha iyi bir performans çıktısı tabii ki bekliyoruz bu durumda.
When you do like very general warm-up exercises like push-ups or sit-ups, it's not very transferable to the sport itself.
Bu yaptığınız genel işte push-up, diğer şeylerin bundan sonra spora daha iyi transferini bekleyebiliriz.
And the last one is the integration exercises. So you try to integrate everything together and then it becomes even more sports specific.
Daha spor spesifik hale geliyor. Bunların hepsini entegre etmiş oluyorsunuz. Can you show what these hand-eye, full-eye coordination jogging shuffles?
I have some videos. If you go on Instagram, okay, on the Crafthletics page, there are some examples for just from my sitting position here. So if you do side shuffle, it's like this. But if you, for example, are a soccer player, you can fixate your eyes on a soccer ball and do side shuffles while doing gaze fixation at the same time, going sideways, running, as an example.
Ya da topu bırakarak oraya işte o az önce gösterdiği shuffle'lar yapabilirsiniz. Top takip ederek.
But if we do a webinar, then I can show you many more exercises.
Okay. Yeah, we will do definitely because it's really interesting point. How many days for the leave courses? 2 days?
For which courses?
For the leave courses for neuro-athletic training.
So Lars's courses are 2 days. They're all in German. And the Z Health courses are in English, but each one is 4 days and there's 11 courses.
11 courses.
Yes.
Yeah, and each one is 4 days, right?
Yes.
So for the 4 days.
Yes.
Yeah. What is in German, you say?
No, this is in English. Z Health is in English, and Lars's Nöro-Atletik workshops are in German.
Okay.
Yeah. So Z Health is all of the anatomy. You get all of the neuroanatomy for every single situation. And Nöro-Atletik is very much more specific to sports.
So, okay, are you giving just neuro-athletic courses also?
I help at both of them, but I do my own webinars for functional training.
Okay.
Yeah. So the best way you can start is if you analyze your current warm-up routine. So you can list all of the elements that I just told you, which is important for a neurologically beneficial warm-up.
Okay.
And then you can list up here the exercises that you currently do, and then you can check off if they meet all of the requirements. And then, yeah.
Kendi warm-up rutininizi oluşturup bunları analiz edebilirsiniz. Kendi şu anki warm-up rutininizi oluşturun. Analiz burayla karşılaştırın.
So this way, because I understand that it's very difficult, that if you're a trainer now, it's difficult to change everything in one day. So then you can kind of know what you're missing and then just make little changes at a time just to meet the requirements.
Her şeyi bir günde değiştiremezsiniz ama küçük küçük değişiklikler yaparak katkı sağlayabilirsiniz.
So then step number 2 would be to actually test your programming and to analyze your programming in the same way.
Okay. Aynı zamanda programınızı bu şekilde egzersiz programınızı vestibular aktivasyonlara uygun olarak kırın. Yani parçalara ayırın.
So this is an example of if you were to categorize exercises according to their vestibular activation.
Vestibular aktivasyonlara göre bu da egzersizlerin aslında detaylandırılması.
So if you know that your horizontal canals are activated when you move your body like this, you know that you have to move along the transverse axis of movement, and you have to do rotational exercises.
Rotasyonel kanalları aktive etmek için rotasyon egzersizleri yapmanız gerekiyor.
So that means if you do with a medicine ball, a lateral medicine ball throw, you know that you activate the horizontal canals.
Medball'la throw'lar dönerek medball throw'lar yaptığınızda da horizontal kanala aktive etmiş oluyorsunuz.
And for the posterior canals, for example, you have to move your head like this or like this.
Posterior kanal için gösterdiğim şekilde hareket etmesi gerekir.
Which means that you have to do a rotational extension exercise, which means you can do it with a wood chop exercise.
Chop egzersiziyle yapabilirsiniz. Wood chop.
So you have to remember that all of the strength training exercises you do, if you want good extensor musculature function, you have to make sure that all of the canals are trained as well.
İyi bir ekstansör kas tonusu istiyorsanız bütün bu kanalların aktif olması gerekir.
So then you can start to do different exercises where you know, okay, this vision exercise trains the peripheral vision, saccades, and convergence, and it also trains the saccule and the horizontal canal.
Yine görsel olarak peripheral, görme alanı, hedef takip etme, uyum ya da işitme şeylerini aktive edebilirsiniz.
So she only moves when she sees the ball.
Sadece top hareket ettiğinde hareket ediyor.
And she follows the ball into her hand with her eyes. That's the goal. So, of course, a lot of these exercises people already do, and you've already seen them before. It's just more important to understand what the neurological components are behind them to make sure that you have a complete training program.
Aslında antrenman şeyini tamamlamış oluyorsunuz. Programını tamamlayıcı hale getirmiş oluyorsunuz bunlarla.
Okay. So was that everything? Not exactly. So we already talked about developing the proprioception, the visual system, the vestibular system, but there are many more aspects to the nervous system, of course. One of them is cognitive loading. So for example, they're calling different colors right now, and the colors actually mean different colors. So they have to do a cognitive task while doing an aerobic training exercise.
Egzersizler yaparken aslında bilgisayar fonksiyonlar da ekleniyor işin içine.
Then you have error correction and accuracy is a very important function of a part of your brain called the cerebellum.
Cerebellum için hatanın düzeltilmesi ya da kesinliği çok önemli hale geliyor.
So they're doing a horizontal pressing exercise right now. And the goal is to touch the fingertip of the partner.
Partnerinin işaret parmağına dokunmak hedef.
So when there's a moving target and the target is very small, it activates much more of your nervous system.
Ve küçüldüğünde hedef daha çok sinir sistemini aktive etmiş oluyorsunuz.
And of course, these kind of training exercises are also much more transferable to sports because the situation is always changing, the flight of the ball, the movements of your opponents, and so your body always has to be doing adjustments. So the strength training program should mimic this.
Yani bunlar kuvvet antrenmanlar, bu antrenmanlar aslında daha çok şey yapabilir çünkü sporda da bedeni, rakip sürekli değişiyor, küçülüyor, takip ettiğimiz şey değişiyor. Dolayısıyla mimik, taklit etmiş oluyoruz.
So, this is also a very good peripheral vision training exercise, but for people who do personal training, it's very important that you understand that group training activates many other parts of the brain that are very responsible for health.
Sağlık açısından çok önemli olan bu grup antrenmanları. Grup antrenmanları sağlık açısından çok önemli olan aslında birçok fonksiyonda uyarmış oluyor, tetiklemiş oluyor.
So if you look at the training programs that they have for people with Parkinson's disease or Alzheimer's disease, they always try to include social interaction because this helps so much with minimizing their symptoms.
Alzheimer ve Parkinson gibi hastalığı olan insanlarda sosyal bağlarını artırarak bunlar semptomların azalttığı gösterilmiş. O yüzden grup antrenmanları da çok önemli aslında.
So novelty in playing is also a very important part of training because of a concept called neuroplasticity. The more novelty or new things that you learn, the more plastic your brain is and the more resilient your nervous system is.
Yenilikler hem sinir sisteminizi daha dirençli ve daha dayanıklı hale getiriyor. Yeni şeyler oynamak.
So it's very important that people and athletes have fun when they're training. Okay, so the biggest takeaways at the end of the day. Move your joints. So these very fine joint articulations, you can basically think about moving your joints, every single joint in a circle at different speeds and positions.
Her ekleminizi farklı hızlarda, farklı pozisyonlarda ve artikülasyon farklı rotasyonlarda hareket ettirmeniz gerekiyor. Kontrollü bir şekilde.
Moving the eyes is very important, so to train every visual skill.
Gözlerinizi hareket ettirin ve görsel yeteneklerinizi çalıştırın.
Move the head and body in ways that unilaterally activate the canals and the otolith organs.
Otolit organı ve kanalları aktive etmek için tek taraflı olarak başınızın hareketini sağlayın.
Uneven is good, so load the body unevenly, not always the same.
Bedeninizi eşit olmayan şekilde yükleyin ve bedeninize tek taraflı egzersizleri alıştırın.
Integrating cognitive exercises during cognitive tasks during aerobic exercises is very effective.
Bilişsel şeyleri yükleyin. Aerobik egzersizler sırasında fonksiyonları.
And play, consistently trying to introduce novelty.
Ve yenilikleri ekleyin.
So if you would like to read any books, I would suggest, I mean, the last three, the bottom three are in German, but the first four are all in English. And these are my favorite anatomy books. But also, if you're interested in the topic of pain, a book called Explain Pain is very, very good.
Alttaki 3 kitap Almanca ama üstteki 4 kitap İngilizce. Bunları okuyabilirsiniz.
So, I spoke with Engin and we discussed that if you are interested in a webinar series, that this is something that we could put together. And the first two-part series would be a neurocentric warm-up, neurology basics, and all of the exercises that you can do to optimize your warm-up.
Ve bizim planladığımız webinarlar bunlar da Tina ile. Öncelikle Neurocentrik warm-up üzerine konuşacağız 2 bölüm.
And then the second half would be, not half, but the second part would be neurocentric strength training and basically breaking down the neurology of strength and how you can improve it.
Diğer 4 bölümde nörosentrik merkezli kuvvet antrenmanları.
So reflexive stability, how you can improve this is the first part.
Refleks stabilizasyon ve bu nasıl geliştirilebilir?
An introduction to nerve mobilization. So all of the nerves that innervate the muscles that tell them to contract. How can you make sure that the nerves are not entrapped and that they are working properly to get signals to and from the muscles?
Ve sinir mobilizasyonu, her sinirin sıkışmadığı uygun bir pozisyonda bu fonksiyonların yerine getirebildiğinden emin olmak. Buradaki ikinci webinar konumuz.
Maximizing joint strength and how you can do this and why it's very important.
Eklem kuvvetini artırmak ve neden önemli bunu konuşmak.
And the last part is breathing for strength training and how breathing can greatly improve your strength output and stability.
Diğeri de kuvvet antrenmanları için sponluğun önemi.
And for all of them, everything has a base in neuroanatomy, so all of the neuroanatomical reasoning for these exercises will also be explained.
Bunların hepsi aslında nöroanatomiyle de ilişkili bu şekilde.
So that's it.
Hepsi bu kadardı. Teşekkür ediyoruz. Bayağı. I think we have been doing for 2 hours. It's quite a bit long. I mean, it's really intensive for the first time because new topic. It is really not a challenge for the people.
Yeah, I can imagine. Yeah.
It's an interesting topic. I really appreciate it, and And I think will open a new window and opportunity for the people. They will challenge their brain. They will learn new things in upcoming months with new webinar topics. Thank you for your contribution, Tina.
You're very welcome. Thank you so much for your interest and listening and having me.
Katılan arkadaşlara da teşekkür ediyoruz. İlginiz için o da teşekkür ediyor. And, okay.
So there are some questions if
Yeah, actually there are a couple of questions.
Let me see here. Okay, how does she integrate the sensory system under load? I'd need a follow-up question for that because I'm not sure what he means. Can we solve the eye problem just by doing exercises with the stick? Yes, you can. I think you meant this exercise. And yes, you can fix this problem with just the stick. Sometimes you need to do other exercises. Some people, in some cases, it's very easy. You do one exercise with the stick and it's immediately better. With other people, it's more difficult. And so you have to do other exercises. But yes, it is possible to fix it with just the stick.
Öyle çözmek mümkün diyor bir tarafı kapatarak.
For the question regarding the pull-up, why does her brain feel under threat? So when the neck is not stable, the cervical spine is not stable, the rest of the spine is also not stable. And you have to understand that the brain's first priority is stability and safety. So in her case, remember that when you move your eyes or you get visual stimulus, that the interstitial and the tectospinal spinal tract, they help to stabilize the neck musculature. So in this case, you can extrapolate that it's because her neck is not under control.
Şöyle just translate. Onda pull-up'ta neden korku hissediyor? Çünkü boynunda ve omurgasında yeterli stabilizasyon olmadığı için bütün şeye yansıyor bu. Göz hareketlerini bu aktive etmek, hatırlarsanız oradaki stabiliteyi artırıyordu. O yüzden daha kolay hale geldi. Ve beynin en önemsediği şey stabilizasyon. Okay.
And then another question is, can she explain a little bit about neurotags? And if you are referring to pain neurotags, then I can explain it very simply like this. If everybody, for example, all of us have shoulder pain, every single person has a very individual neurotag for this pain. So even if we have the exact same shoulder problem and we have the exact same pain and the exact same motion, at the exact same intensity, if you did fMRI scans on all of our brains, different parts of our brain would be active while experiencing pain. So a pain neurotag is essentially which parts of the brain are active for this one specific person when they experience pain. And it's very individual.
Aslında diyelim ki şöyle, herkeste aynı şiddette, aynı açıda aynı ağrı var ama fonksiyonel MRI yaptığımızda herkesin beyninde farklı yerlerin aktif olduğunu görmüş olacağız.
And the last three questions are in Turkish.
There are lots of questions actually.
Oh, are there? Okay.
Yeah. Just I try to keep my thinking and translating to you, focusing on.
I have to say this must be very hard for you.
Yeah. The question is like the hockey player who had a trauma. When did you start the rehabilitation? Like after the trauma?
So 2 weeks after he had the hit. However, 1 year before, he had another hit, a very bad one, that he was in bed for 2 weeks. Basically, he couldn't move. So, but after the hit that you saw in the video, it was 2 or 3 weeks after.
2-3 hafta önceydi o şey, başlamadan önceydi videoda gördüğünüz ama 1 yıl önce de yaşanmış. Can we use, is it okay to make sense peripheral traumas 20-25 years ago? So you can apply these protocols or these systems,
Yes.
these methods for the
Yes.
traumas. Is it
Yes.
possible?
And most likely, these people have problems visually and vestibularly, and they lived with them for the 20 to 25 years, and they compensated for it for this long amount of time, and it has many other negative effects.
Aslında birçok diğer negatif efektleri de var. Kompanse ederek geldikleri için ama tabii ki yapabiliriz. Then maybe it takes, I mean, when we compare the 2 weeks before trauma and 25 years ago trauma, so maybe it takes time to get better because one is really old and structural problem in his brain because it's stored 25 years and they have more compensation mechanism. So when it happens 2 weeks ago, it's more new and fresh. So you can have better healing process, right?
Maybe. It really depends. I would say my tendency is to say yes, but it also really depends on the recovery process of the person. So as I said, the athlete, he worked very, very hard. And most people who had a concussion 20 to 25 years ago, they're not going to work as hard as the hockey player because you need to accumulate a lot of repetitions.
Yeah.
So the success really depends on how hard the person is willing to work. And so to rewire everything, they have to do a lot of work.
Şöyle, tabii ki buradaki başarı çok, yani 20-25 yıl travmada çok fazla tekrar etmeniz gerekiyor. Çok fazla şey biriktirmeniz, hazırlamanız gerekiyor o insana. Sonraki o connection'ları, bağlantıları sağlayabilirsiniz. You are not a physiotherapist, right?
No, I'm not. Just a trainer.
Aslında sadece trainer. Okay.
So usually, as I said, all of the people I work with, they've already seen all the doctors and they went through the whole physiotherapy process and all the other therapies. And I'm basically their last hope, I guess.
Okay. Aslında son umutlar olarak çalıştığım insanlar genelde.
Yeah. Okay. I think we have time for one more question.
Eylül ayında başlamayı planlıyoruz. Bir aksilik olmazsa webinarlarımıza. When you're asking me a question, when you're planning to start the webinar series, so I just say that we are planning in September.
Okay.
Okay, for the webinar. Katıldığınız için hepinize teşekkür ediyoruz. Maybe we can talk about the schedule after we let go the participant out, and then we can talk about the dates.
If it's okay, can I call you on tomorrow, and
Yeah.
then we can do it, and then I have all my stuff ready.
Okay. The last question. Do you know about Norbokov exercises?
I don't know the name. No.
Bilmiyorum.
Okay.
Hepinize teşekkür ediyoruz. Gerçekten uzun bir süre oldu. Olarak 2 saat 15 dakika. Umarım faydalı olmuştur. Önümüzdeki dönemde tekrardan görüşmek üzere. Thank you, Tina, for tonight. I mean, you did a really good job. I really learned new things, new windows for me.
Very good. Very good. I'm happy.
Thanks for it.
Good. You're very welcome.
Yeah. Guten Abend.
Thank you so much. Guten Abend. Have a good night.
Thank you.
Bye, everybody.